Andy Penn. Good morning.
Hey, Doc.
Morning. Great to see you, Bart. Andy,
Good
great
to see you.
you.
Today we're going to talk a little bit about discs.
Yeah.
What is the disc? What is a disc?
So the discs are little cushions in between each vertebrae.
Okay.
And so there's 24 individual vertebrae in the spine. They all move independently of one another. And then inside, or in between each vertebrae is a disc. And that acts like cushion, support, like a shock absorber for the spine, so that it doesn't just fracture all the time, right? So it acts like a real shock absorber and gives us a great deal of freedom of movement.
You hear like herniated, bulging, degenerative, all problems related to the discs.
They are. And unfortunately, it's preventable.
Yeah.
It really is preventable. We always have focused on the prevent model, Andy, but unfortunately, when there's alignment problems in the spine, they ultimately, think about like alignment on a vehicle. What happens to the tires if we don't get the alignment taken?
We get
All
uneven
over
wear.
Uneven wear and tear,
yeah.
right? So that's what happens to the discs when there's alignment issues with the vertebrae. There's uneven wear and tear on the disc, and over time that becomes weak, and then a certain movement makes us vulnerable, bending, twisting, lifting, pulling, reaching all at the same time, even if we're young in our 20s.
What are they made out of? Are they soft? Are they hard?
So that's a great question. There's two, Bart, there's two types of material. One is more fibrous, which is kind of more like a ligament. That's the outside rings of the disc. And then inside the disc is kind of like a jelly type structure. And that's called the nucleus. It's kind of provides nutrients to the disc, but that is what, unfortunately, when the annular fibers, the outside fibers tear or they become weak or dehydrated, that can shift and that can cause a bulge or herniation, which ultimately hits the nerves, or can hit the nerves, or even face the spinal cord, which can be very, not only painful, but detrimental to the nerve supply, carrying information wherever it's going.
And Penn Chiropractic is a certified disc center of America now, so you're able to help people in a lot of non-surgical treatments, which, gosh, everyone wants to avoid being under the knife, and you've got some great care that you're able to provide.
We're very fortunate to be invited into this group, and the training that we've gone through, there's a couple hundred offices around the country that are nationally certified, and really it kind of elevates the standard in terms of protocols that we've put together over really the last 10 years, and we've recently joined this group, so it's a great mind share. We have offices all over the country, so if we have friends or family, we can refer them, or if the viewers have friends or family in another state that have some disc issues, they can reach out to Disc Center
Tell me
of
about
America.
this. Tell me about this table here. I have seen it in person.
Oh, wow.
Yeah, so this is the Accuspina. This is the most advanced table for non-surgical spinal decompression. In fact, this technology is actually called intervertebral differential dynamic therapy. So this is the table that we have. Here, there's this patient's being shown they're getting their low back pulled. Do you see that angle, that tower? See that tower? That can change angles, Andy, and that ultimately we can really specifically target what level of disc we're dealing with. If it's L5, is it L4, is it L3, 2? So we can change the angle, but the computer there's all kinds of doctoring that goes into that in terms of pounds of force, in terms of body weight. And at the end of basically this high pull, what differentiates this table and what separates it from any other spinal decompression table is they patented an oscillation. So at the end of the pull, there's kind of a vibration or oscillation, and that creates more opportunity for nutrients and hydrogen and oxygen and glucose to get kind of pulled into the disc, and that then is what creates more hydration and becomes more curative for the disc. So we're able to create a vacuum phenomena
Careful
that then sucks
Wow.
nutrients back in.
I think, Doc, people living in pain, I mean, you don't have to live in pain, right?
Typically, no. I mean, not everyone qualifies for this type of procedure, but
We're going to look at a quick before and after a decompression here picture. Yeah.
so you see this is looking at a side view of the lumbar spine. You see the circle there where that material is pushed into right? That's actually effacing the spinal cord. That's the cord that's sitting there, right? Now look at the post picture. This is the work that we're doing and Disc Centers of America are doing, is that we're creating that vacuum phenomena that can then suck that nucleus or herniation back into the center of the disc.
It's like a 2x4 in your house, you know? You need it straight and going the right way, not crooked. I mean, there's plenty of analogies, Bart.
Yes, there are. And particularly when you bring in this model, you can actually see, you know, I've seen, you know, the model of the spine before, but I really never noticed what's between. And that's the discs.
Mm-hmm. Yep, that's the cushion, those are the discs, and unfortunately when they do, maybe that's a better view if we can get there, is when they do herniate, that's what that little red guy there, that's what that's kind of indicating, is that's pushed out of the center of the disc. We see that there.
Yeah.
How many of us are living with these issues and just dealing with it and just...
Unfortunately, this is so common.
Yeah.
And especially if it's not prevented. Again,
Right.
if we can really take care of the spine and nerve system early on, from birth through growth and development, youth sports, all those things, these things can be preventable. Unfortunately, it's very common. Like 80% of us have some back issues at some point, not always disc related. And the other thing is, a lot of times disc problems aren't even symptomatic. So we can have them, and most athletes unfortunately have them because of impacts, and
They don't even know it.
and they
No,
may
not
even know
until
it.
not until the pain finally comes, right?
Until they maybe push far enough that it's
Right.
hitting those delicate nerves. And then that's sending a message to the brain, wow, we got to do something, and the system is under stress, and then we run into these pain cycles. Unfortunately, the medical options are invasive. They're, you know, we have opioids, which are addictive. We know that whole issue. Unfortunately, injections that can be dangerous and can cause neurological deficits, and then unnecessary back surgeries, which are, a lot of them are preventable. Now, sometimes we need them, right? So it's because we can't help every case, and we need our neurosurgeons and those guys, and we work with them. We work with other physicians that you know, that when we find a case that's outside of our league, then we have to refer.
Amazing. I'm worried about my back right now as we
Well,
look
you
at
should.
this.
It sounds like you might want to go in.
I know.
But now we have Disc Centers of America right here in Jackson at Penn Chiropractic. Another way that you're able to serve the community, and people want to come in for a consultation. I know you're happy to have them come in.
Yeah, there's really probably one of the best ways, Bart, is when we do complimentary MRI reads. If people they know they have disc issues, things like that, we can do an MRI read to see if they qualify for care in our office. And if they just, you know, Google Disc Centers of America, Jackson, they can fill out an online form.
Awesome.
We can do it like a pre-consult, you know, to see if they even qualify, if they're good candidates.
Dr. Penn, and you've been practicing for 30 years already, which is amazing.
30 plus.
Congratulations.
Yeah.
30 years. If you're in pain or you want to learn more about the disc problems you're probably having, please give Dr. Penn a call. Again, been practicing for over 30 years. Doc, thanks so much for being with us today. We appreciate it.
Thanks, Andy. Appreciate it. Bart, appreciate it.
Doc Penn here on The Morning Show. We'll be right back. More after this.